Hello everyone. The last 2 weeks have been super crazy with cases of Omicron spreading like wildfire. There are cases like almost every other household. So, what I have seen so far in children is that Omicron in children is mild. Fever is usually getting better in 2 to 3 days. Most of the children are complaining of some sort of throat irritation. Some are even complaining of severe throat pain. So, this throat pain is really bothering a lot of parents and they are insisting for antibiotics. As I said earlier, also, antibiotics will not help in throat pain, even azithromycin. You just have to keep the child comfortable, give them paracetamol, give them warm liquids, gargling if older children can do gargling. It will get better on its own. Usually, this throat pain is the severe form, may last up to 3 days, mild throat irritation up to 5 to 7 days IMC. Some children are presenting with headaches. It's a little unusual in children, but then again, same treatment. Give them paracetamol, let them sleep, let them have good rest, let them have lots and lots of liquids and stay well hydrated. Younger kids, what I'm observing is that they are having a lot of irritability or crying or they are a little dull. Sometimes, in fact, the parents are complaining to me that the child is very irritable and after 12 hours or 24 hours, the child is getting fever and later turning out to be COVID positive. What I would recommend if you feel the baby is very irritable, very restless, or a little dull, preferring to just lie down, give some paracetamol. It could be body pains, it could be the beginning of some throat irritation, and younger kids cannot communicate. Having said that, so far what I am seeing amongst the so many cases we are seeing in our department every day, kids are doing well. We have had a few admissions of children less than 2 years. Most of them have been admitted because of some upper airway inflammation. We call it croup. In this, the child has a barking type of cough. But those children also I have discharged within 1 or 2 days. Some young kids I have admitted because of very high fever, some because of loose motions and a bit of dehydration. But all kids I have managed to discharge within 2 to 3 days. None of them have required any oxygen. Yes, some nebulization, IV fluids, and very basic care. So yes, Omicron is mild in children. Do not panic. If your child gets fever, just control the fever with sponging and basic paracetamol. But the bad news is Omicron is extremely contagious. The way it is spreading, even in our hospital, lots of doctors, lots of staff have fallen sick because of Omicron. So I would recommend for the next 2 to 3 weeks, if possible, to avoid contact with outside people as far as possible. And if you are having contact with outside people, please wear N95 masks. They are saying cloth masks and surgical masks may not be so effective against Omicron. And the important thing is to keep the children well hydrated, to keep them comfortable. That is something you should keep in mind. So basic mainstay of treatment remains the same. Just some liquids, paracetamol. If vomiting is there, vomiting medicine. If loose stools is there, you give them ORS. It doesn't seem to be causing pneumonias even in children, which is an excellent news. I think we should peak in another week, and then hopefully by 2 to 3 weeks the cases shall come down. So all of you stay safe.